Let's start. And thanks for joining us this afternoon. We're delighted with the turnout, especially at that prime time hour of 4 o'clock on a Wednesday. Um, we've gathered leaders of three organizations who offer front door services in Corvallis and work to help their clients, obviously, work also to help those clients understand other services that might be available to them. I'm going to briefly introduce all three, but I'm going to leave it up to them to talk in more detail about what they do in the community. A couple of housekeeping notes. We are going to allow time for questions. We ask that you type your questions into the chat, and so we can kind of collate them and kind of categorize them, so we're not asking the same question over and over and over. But we will leave plenty of time for questions. We are recording. We know that there are people who wanted to be here, but again, shockingly had other things to do at 4 o'clock on a Wednesday. So let me briefly introduce our panelists here. Shawn Collins is the Executive Director of Unity Shelter. Allison Hobgood is the Executive Director of the Daytime Drop-In Center. And Ilene McClelland is the Executive Director of Vina Moses. And Ilene, let's start with you with this question. What does your organization do uniquely in the community? What's the mission at Vina Moses?
Well, we help people through times of hardship and also make connections in the community. And we aid about 7,000 people a year, and we provide low barrier free aid anywhere from people who are experiencing homelessness to families barely making ends meet. And that could be anything from things inside our free thrift store to our seasonal programs to financial assistance.
Now, Unity Shelter and the Daytime Drop-In Center, they might have some ebbs and flows in the season, but how does the work at Vina Moses change over the course of a year?
Well, one thing that is kind of our constant is Vina's free thrift store. And that's where we see kind of the widest variety of people. It could be, when I talk about 7,000 people, that's really the core of that. But we do have seasonal programs, like we have a back to school program where we partner with other organizations. And then we have right now, we're in our Giving Tree program, we're just wrapping it up. And that's also where we see a lot more families. Although our free thrift store also sees families. We're very family oriented. Boy, that's a huge question. Right now we are very like a kid focused at the moment. And we're actually running two different centers at this time. So.
Okay. But you see families pretty constantly throughout the year, it sounds like.
Yeah, and some people have probably noticed over time that around like during those programs in August, like we used to close our free thrift store because we would have just one program open. But one of the things we've changed this year is we're starting to run our programs together concurrently, right? Instead of we're utilizing the small space that we do have to do as much as we can in that one space. So this year, say for our back to school program, we actually split the space and used half of it to keep it open for people who wouldn't normally get a chance to access our other services during August. And we had our kid program going on the other side of the building.
Okay. All right, Shawn, let me turn the focus over to you. Talk a little bit about Unity Shelter and the people it serves.
Sure. So Unity Shelter offers emergency shelter and transitional housing. So we operate both a men's and a women's shelter. We have some shelter available for families at times through our hotel program. And then our Safe Place Transitional Housing program, community members might have seen micro shelters in different locations around town. We're in 6 different spots around town. The folks we serve really are either unsheltered. We operate daytime services at the hygiene center, which is at the site of the men's shelter, 11 to 4, 7 days a week. That's showers, laundry, some food, some other basic needs things. And so we're really serving unsheltered people there. And then we've got the shelters and transitional housing program.
Okay. Allison, over to you. Talk a bit about the Corvallis Daytime Drop-In Center.
Thank you, Mike. Thank you. My name's Allison. Again, I use she, her pronouns, and I work at the Corvallis Daytime Drop-In Center. Thanks to everyone for coming into this space to learn and grow and share. So I'm honored that Jen was and Mike were able to set this up for us. So I support a day resource navigation and resiliency center that is downtown in Corvallis on 4th Street. We're essentially the lowest barrier point of entry for people experiencing poverty in the Tri-County area. And by that, I mean that folks who are often fearful to access other kinds of services, folks who are unable for various reasons to access other kinds of services, folks who are experiencing co-occurring mental health disabilities and substance use, as well as poverty. We are the hub for anyone who needs kind of fundamental support in our local area. We see over 1,000 people a year lately. Plus, we see a larger number of folks in our direct street outreach program as well. So we every Wednesday and Friday send a team of volunteers and other service providers out into the community to local encampments where people are staying to literally meet them where they are. And our main goal at the center is to see people, hear them, love them, remind them that they have value, and then build basic needs navigation and next steps as they're ready for that, on top of that kind of fundamental compassion and healing. We have a kind of unconventional healing arts behavioral health program, super low barrier counseling. We help people with all kinds of things from lost identification to, first steps toward affordable housing. It's really kind of where someone is. We have a lot of peer supports around substance use disorder pathways to recovery. We also practice harm reduction. So if people are actively using substances and they need support around that, we provide that as well. So it's kind of an eclectic place with a really diverse group of beautiful humans. We serve primarily adults between the ages of 18 and 80. And we're also a major a resource and referral point of entry. So I like to think of my phone and my staff's phone as kind of like bat phones, and someone comes in and says, I need to get connected to something, or I need help with this. And we say, we know exactly the right person. And our goal is to kind of lower barriers and red tape and make the ability to move forward or kind of take even tentative next steps for people really as easy and trauma-informed and chill as possible.
Allison, I'm going to stick with you for this question, but I want to ask how all three of your organizations work with other organizations in the community. But I think everyone on the call probably knows the answer to this question, but what do we mean when we talk about low barrier services?
From our perspective at the center, low barrier means that you can come as you are, as long as you are not an immediate danger to yourself or others. You are welcome. So we will meet, like I said before, meet people kind of literally where they are. And low barrier also means what I mentioned, that you have immediate warm handoffs and points of connection with other service providers. Part of I think the power of the drop-in center that I wonderfully inherited when I became ED, shout out to Alita Hess-Holcomb, who laid so much of the foundational work for this, but is that we have service providers from other agencies who are not just on the phone, but are physically at the center. So today was a Wednesday, and so county health navigators were there, needs navigators from Samaritan Hospital, social workers from Samaritan, ACT team, county behavioral health people were there. You name it, people are around. And so I'm able to say, hey, Mike, how's it going today? I heard that you had a wound on your leg. Do you want to talk with Penny, my friend here, about getting on Oregon Health Plan, and then also maybe talking with somebody about finding a primary care doctor. We can help you with that. So just creating a safe space for us that's also explicitly kind of non-clinical for people to come in and access all kinds of services.
Okay. Shawn, the same question over to you. How does Unity Shelter interact and work with other community organizations?
Well, I think that, I mean, we are low barrier services as well. And so I think Allison described that very well. You know, I think that the intent is that however people present at our door, as long as they're safe for themselves and others, then they're welcome. It's really more about behavior than any substance or mental health or criminal background or anything like that. It's really more about how can they interact with other people. We work a lot with other organizations. Work a lot with the Drop-In Center. We work a lot with Vina Moses. We work a lot with the county health department. Good Samaritan has done mobile medical clinics, both at the Drop-In Center and at the Hygiene Center. And done vaccine clinics, things like that. County harm reduction staff are regulars coming through the site, and we partner very closely with Corvallis Housing First for case management across our program. So it's a pretty long list of direct service agencies that we partner with, and we partner as well with a number of churches in the community who are hosts for our micro shelters. And so it's pretty broad. And I've done a slide before that kind of lists all the folks, and it's hard to get it all on one slide because there's just so many people that we work with.
Mike, can I just interject again? This is Allison speaking. Just to piggyback quickly on Shawn. Other ways that are maybe less obvious, I think, that we partner too is that, you know, if Unity and the Drop-In Center are seeing a guest across both spaces, our staff will check in with one another about that person. So they've got kind of like a rounded out holistic team. So, hey, how did it go at shelter last night? That person's headed over this direction. What do we need to do? I think we also, across all of our agencies, are from our EDs and to all the rest of our staff are just supporting one another too in really, really important ways. At least I feel supported by Shawn and Ilene all the time.
Ilene, over to you. How do you work with other organizations in the community?
Well, everything those two said. And also, we do, like, other organizations will come to Vina to shop for the people that they're working with. And when I say shop, I have to say it's all free, right? So we do have other organizations come. We'll reach out during inclement weather, or either when it's cold or it's hot. We'll reach out to the sort team if we know we're not going to be around to unload. Like, I don't want to hold on to stuff that could go to somebody over a weekend, or another day that we're not going to be around or something. But we also have like a Benton County Financial Assistance Network, which is something where we'll pool our money together to assist a family and make a bigger impact and be able to pool more money together to help a family, as opposed to something that we could just do on our own. Like, we can do more if we all work together. And a lot of that happens outside of the organizations that have deeper pockets, although we do work with those organizations too, but we work together to fill those gaps that exist. So we do a lot of gap filling with our partners.
I remind you, you can post questions in the chat anytime. We're working on keeping an eye on those when we move to questions. I'm going to mix up the order in which I ask you to answer the question so that no one answers first all the time and no one answers last and says, well, yeah, whatever those two said, that all goes for us too. So Shawn, I'm going to start with you, and I'm going to bounce back to Ilene for this one and end with Allison. It's kind of two questions here. Who is homeless in Benton County and why? And another way to think about that, every story is different. Every client has a different story. But as you work with your clients, what are the recurring themes that you see?
Well, I think, the first thing I would say in terms of who is homeless in our community, it's largely folks from our community. I think historically, the shelters have kept records of who we serve and where they've come from for a lot of years. And year after year, it's 70 to 80% of the people that we serve are from the Mid-Willamette Valley. So think about Sweet Home to Corvallis and Adair and, you know, down to Alsea. It's really very much friends and neighbors, and we see often generations of folks. So people who, you know, who have raised children and who experienced homelessness at different times, been homeless themselves, and then the children experience homelessness. So it's very much a phenomenon it's local. I think that when you think about why people are homeless, as you said, Mike, you know, everybody's got a different story. There's a lot of different paths. I think there are some common denominators. One of them is just raw economics. I think that if you look at the cost of housing in Corvallis and Benton County, it's far above what you could pay for with minimum wage and a 40-hour week. In fact, the kind of recent numbers would suggest that minimum wage, you'd have to work about 75 hours a week to be able to afford a one-bedroom apartment in Corvallis. We're one of the highest rent burden communities in the state. So a lot of people are paying 50% or more of their income just to stay in a place. So some of it is raw economics. Some of it is a combination of economics and a lot of life events that have come together, maybe just to create a crisis for somebody where they don't have funding, or they've had to leave a household because of domestic violence or other issues in the home, or unsuitability of the home. Sometimes an apartment or house is not really suitable to live in and people have to leave. Sometimes people just lose their lease because the landlord can find a better, you know, a different renter. And then there's what I would say the kind of long-term impacts of adverse childhood experiences. If people think about there's a study called the ACEs study done by Kaiser Permanente and the Centers for Disease Control that really looked at the impact of childhood trauma on health outcomes in adults. And the more childhood trauma you've experienced, adverse childhood experience you've had, and that might include divorce, mental illness, addiction in the home, incarceration of a family member, death of a family member, sexual or other physical abuse, things like that. All of those, the more of those things that you've had, the more likely you are to not really have the coping skills to deal with things later in life. So you've kind of managed for a long time in your life. We see this all the time where somebody's managed to be housed and successful for a very long time in their life, and then a partner dies or a job loss happens at the same time as a medical event. And so their finances crash, other things crash in their lives, and suddenly all their coping mechanisms that they've had aren't enough. And it can kind of spiral into a lot of problems that will send people out. So it's a lot of different paths to end up homeless. And I think it's one of the reasons that a lot of the work that we do in Unity Shelter and across the service provider network is really pretty much custom work, right? You're trying to understand an individual and the path that got them there and the barriers that they might have to being able to get out of homelessness and back into housing again.
Shawn, before I go over to Ilene, how many people does Unity Shelter work with in a year?
Well,
roughly.
I just closed a slide that had the total number, but it's well over 1,000. So just this year at the hygiene center, we've served about 1,000 people year to date, and that's a 27% increase over last year. And then you think about I think 400 people that we've served in our emergency shelters and the 150 people that we've served through the hotel program this year. It's a lot of folks that we've served.
Ilene, over to you. What are you seeing from the folks that Vina Moses is serving?
Well, I want to talk about it a little bit in context of poverty in general too, because we do see a lot of homelessness, but we see a lot of hidden homelessness, you know, and those are families, multiple families living in some place that maybe isn't big enough for all of those families or for all of those family members, or someone who has left a relationship or had a relationship change and doesn't have anywhere to go and is sleeping on a friend's couch or a family member's couch. People we see are people who have jobs, who may or may not have a place to live. And a lot of the people that we see, and I know this is true for all three of us, we're really that trusted place for people who maybe don't have a network. They don't have a network, or if they do, their network doesn't have the means to help them, right? I mean, we can probably all think of times in our lives where we came up short for rent one month, or just something happens, you got sick and you don't have paid sick time. There are a lot of jobs out there, low paying jobs that do not have paid sick time. And we see a lot of that as far as preventing homelessness, to help people with rent or utility or something, to be able to intervene during those times and when they haven't been able to make it. And we can all think of that. We've all had that moment where, you know, maybe you had somebody who you could lean on to help you out. Not everyone has that. And so I feel really lucky as our organization to be able to be that trusted space, to be able to be there for someone when it's hard to ask. And I can think of people, think of one person in particular who talked about when they were unhoused for a while and they used to come into Vina Moses and they felt like their life was saved, every glove, every jacket, every blanket, everything that we could give to them. But, you know, now they are a manager and almost came up short with her rent one month, but then didn't in the end. You know, it's just, those are great stories. Is it people that, you know, came to us for one thing and then came to us for something else? Which I should mention too, we do survey the families who come to Vina Moses a lot. And one of the things that we learned is that a lot of people who come to Vina, they don't come every month. They come during times when they need it. So they might come for maybe 3, 4, 5, 6 months, maybe a couple of years, and then they don't need what we have. And so they'll go on their own merry way. And then they may come across another time when they do need us again. And so they'll come back. So it's not always the same people that we see every month.
Do you have a sense, like Shawn has, are most of your clients local?
Yes, most of them are local, for sure.
I was so happy that you made that point about hidden homelessness. You know, there's a lot of attention given every year or every other year to the point in time count. But everyone who works with that knows that that point in time count is a dramatic undercount of the actual extent of homelessness or houselessness in the communities. Allison, over to you. It looks like you're muted, but you can unmute.
Thanks. I so appreciate Shawn and Ilene's answers, and I would agree totally. I guess I would just like to offer a perspective around the fact that what we're seeing isn't an accident. It's the deliberate outcome of things like capitalism, white supremacy, ableism, all of these pressurizing oppressive systems work actively, right, to lift some folks up and to marginalize many others. And I just wanted to share with the group some statistics from the center to give you a sense of how that looks in actual practice. So the Benton County census in 2020, 0.1% of the population Benton County identified as Native American or Indigenous. At the center, 15% of the people that we serve are Indigenous people. Again, that's not an accident. That's systemic oppression working the way that it works. 76% of the people that we serve are people who self-identify as people with disabilities. So one of the pathways to homelessness for them is that disability has been a factor in their life experience, and the world is set up not for disabled people of all stripes. 1% of Benton County in 2020 identified as Black or African American. 8% of the people that we serve at the center are folks who are Black or African American. So, you know, it's so hard to disrupt these cycles because they're not accidental. And one of the things that we've been really trying to do some work on at the center is helping people as they're self-advocating and or as they're just really struggling to not blame themselves, because all the things that Ilene and Shawn pointed out are factors that transpire to have someone end up outside or living in their car. But on top, so your ACE score and all the rest of it, but on top of that, there's just all of this, literally like interlocking systems of oppression that are producing people's experiences. And when people realize it doesn't make them any less frustrated necessarily, but there's less self-harm and self-blame when you can kind of understand how those systems are working to unfortunately like deliberately marginalize you as a homeless person.
That's interesting, Allison. A follow-up question: how do you work people out of that cycle of self-blame? Because that's probably not an easy thing to do, because these people are probably, I mean, a lot of these folks here, they're to blame for whatever straits they find themselves in. But how do you work to kind of get people out of that cycle?
Great question, Mike. I think the way that we hope to do it at the center is to just consistently remind people of the value that they have. I mean, one of the things that our volunteers do, we have over 50 volunteers that support the center, both at the center proper, Monday through Friday, and then on outreach every week. So shout out to those volunteers. They're incredible, and thank you to them, some of whom are on this call, so love ya. But some of what we work to do is to know everybody's name. Now that might be their street name or a made up name that they use at the center, but to be recognized as a human and a human of value, I think is just the starting place for all the rest of that. One of the things that we also practice at the center that is a national best practice, but doesn't happen often, also because there aren't a lot of, honestly, there just aren't that many day resource and navigation resiliency centers around even nationally, but we do something called direct cash transfer. So if you came, Mike, and you were like, hey, I have a prescription at Safeway for $11 and I can't afford it, we will give you $11 in cash and say, bring us the receipt. And that kind of a transaction that is about trust and care and belief in the other person, those are the kinds of foundational things that I think then start to bring people out of those cycles of self-blame, and then also enable them to see that there maybe is a way forward into the future.
I'm going to sit here for a second and just ponder the possibility of having a prescription at Safeway for just $11. Not to pick on Safeway or anything, but Ilene, I want to start this next question with you, and this kind of ties into one of the questions that people are starting to ask in the chat. What do you see as the growing edge here? What needs to change in our community regarding chronic houselessness and poverty?
Of course, I'm going to say the cost of living is a lot in Corvallis. It's high. Cost of housing, types of housing that we have. And I just to speak to what Allison was saying with how our institutions work, and I know that our public assistance systems mean well, but they're really designed to keep people in poverty. You know, if you have a housing voucher and you get a job, you can't really get ahead. You lose some of that benefit just by working, by someone who wants to work. And that's really hard for everybody, us as providers and the people who are living it. But yeah, the things that make it easier for people to be able to stay here in town. It's too much for too many people.
Shawn, what do you think?
Well, I think we live in a culture, particularly at the moment, that seems to value property more than people. And I think somehow we have to start changing that equation. I think that we have to put people's needs first. and understand that everybody shares some basic needs. I mean, I think the comments about the systems of oppression and the way that the game is somehow rigged to keep people in poverty are right. It's incredibly hard to navigate the systems. It's incredibly hard to overcome some of the barriers that people have. Some of the criminal charges that will keep you out of housing are charges that are almost inevitable if you're homeless, like trespass, right? And littering, and a variety of things can show up on your record that are just a direct byproduct of not having an adequate housing situation. And I think that until we start to really recognize ourselves and the other, and make accommodation for the real vagaries of life that can afflict us all, and the reality that most of us living a lot closer to the desperation that comes with being homeless than we really want to admit, because it's too terrifying to admit. I think if we can start to face that, we might be a little bit more humane and try to re-rig the system so that it actually supports people's basic needs.
Allison, go ahead.
Thank you. All that, plus I would just add, I think the larger kind of service, and again, this is not to blame anyone, but the larger service systems, government and otherwise, that we operate ultimately within are reactive as opposed to proactive. So you're aiming, we're trying to do this a lot in the center, to get out ahead of something. So intervention strategies, preventative mechanisms, diversions. But really the way that it's structured is that the bottom falls out and then somehow there's going to be a response. So I think if we could, as we're thinking about restructuring of systems that Shawn's pointing to, we've got to really, really nail down things at the earlier intervention strategies. So how do we keep people from going to jail in the first place? How do we take something like Measure 110, which super cool idea in principle, but actually make sure that we've got active SUD programs and beds that we can divert people into, so that, we can create radical, structural systemic change. I think people, like Shawn said too, I think humans fear things that are different. I think we're afraid a lot of the time. I think we're afraid of people who seem different. And instead of leaning into those differences and finding commonalities, people will actively work to not see other folks who they don't recognize themselves in, and that there's a practice that we have to actively work on as human beings to see each other and see each other fully and in all our flaws. I also think that we're stuck in like a carceral state. It's like you make one bad mistake 100 years ago and you're screwed forever. And it's just totally not fair or equitable. I mean, we've all made mistakes. I have made a few in my life, and they just were that notch off of a thing that then redirects the course into something that could mean that I was a guest of the center myself. And so how do we forgive people for mistakes that they've made, and forgive each other and move forward, and not punish people for a lifetime for something that they did, that maybe a lot of us had done, but we just didn't get caught for, let's say.
Yeah. Shawn, I'm going to start with you in this next question. I'm going to tie in one of the chat questions here. What can community members do? Or how can people in the community best help advocate for your groups? Do we press city council? Do we press the county? Do we donate money, time, all of the above? How can the community, what are the best ways for the community to get involved, to help?
All those suggestions are good. I think that, but I think I would start a little bit more basic. in terms of what to do. And I think it relates to some of the comments that other folks have made about seeing people. I think it's so important not to look away and to make eye contact, to acknowledge the person in front of you. It's incredibly easy, and I've done it myself, to cross the other side of the street, to not engage and make eye contact, and sometimes that's the right response, right? There are moments where somebody's really in crisis and you don't really want to be right there, but generally it's not the right response. I think that homelessness is incredibly isolating, and I think if community members don't acknowledge somebody, you might see somebody flying a sign at Winco or some other parking lot, and maybe you don't have money or a pair of socks or something to stick out the window, or you're not comfortable with that. At least a smile can do an amazing amount for somebody to feel like they're a human being and have some worth. So I'd kind of start there. Beyond that, all of those suggestions about talking to your electeds make perfect sense, right? I think that this is my observation, it may not be true, but I think that when the pandemic started, there was kind of a bubble that was erected around city and county government electeds and staff, and it was a bubble that was enforced by the pandemic conditions. And in some ways, that bubble's never been broken. They don't hear enough from constituents about what they'd actually like to see in the community, the kind of supports that would be reasonable. I think that if people are really concerned about trash in areas where people might have camped, advocate for trash pickup in those areas, advocate for Republican services to, the city or county to pay for a dumpster in an area that's being camped. I think it's hard to blame people for making trash. We all do. When I go home tonight, I'll be carrying mine out to the curb, right? But tomorrow morning, Republic Services will come and pick it up and take it away. That's not the case if you're camped in the community, right? So I think that we need to talk to our electeds. Beyond that, I mean, material donations are really important. I mean, Vina, the drop-in, the shelters, we all live on material donations. It's a huge part of what people can do. And then, financial support's always great as well. I could go on a couple of those, but I'll let other people speak.
Okay. Ilene, that same question over to you. What I maybe
I have
We
two
can hear
things.
you, Mike.
We can hear
you
you.
hear me?
I got it.
Go ahead, because I'm getting an alarming message that my Zoom meeting is not responding.
Oh,
Go ahead.
We can hear you.
Okay.
Well, I would say for everyone here to find a local cause that you care about and set aside time for it. And setting aside time could be reading about it. It could be subscribing to a local newsletter, could be attending city council meetings, could be volunteering at a place, and just do it on whatever time frame works for you. And then I would also say to practice connection with other people, right? Like make time to connect with others, and just to remember also, because you don't know what people that are going through. And if they're not going through something, they may know someone who is. I just think it's really important that we're connecting with each other right now. And a thing to remember with that too is that people who are outside, who are living outside, they're doing the best for themselves, or doing the best things that they can right now. And that doesn't mean that that'll be true forever. And part of that is really practicing connection and being kind. I think it's good practice to be just prepared for when anybody needs you, even if it's not smile when you're walking by.
Allison, same question over to you.
Thanks. I would just kind of riff on what both Shawn and Ilene said, and maybe kind of three further thoughts. One is just educating yourself as much as possible. So if you're interested in, climate and ecological justice, or you're interested in criminal justice reform, how are the ways that homelessness, of course, is like tied into all of those things. And really just taking some time to learn about how and why the folks, and you're already doing that because you're here in this meeting, so thank you. But how and why are folks experiencing poverty in the United States of America in essentially 2025 in the ways that they are. I really like Ilene's encouragement toward thoughtful and intentional community engagement and giving. Shawn had mentioned the importance of material donations, and that's absolutely true. I would just say that there's a difference between someone, though, who cleans out their closet and brings it to Vina Moses or to Unity or to, because there's just nowhere else to put the stuff, and versus like, wow, who is the population that is in need? How can I target these donations in a way that are really going to support those people, that organization? So just approaching your giving with intention. And then I wanted to also just talk a little bit about how stoked I am that from the governor on down, there's been a real push about affordable housing, and that is great. Of course, we need more places for people to live, but as you're advocating with your council members, with folks at the county, whoever your electeds are, please remind them that from getting through a journey from living in the meadows in a tent or at the skate park, in your car to an apartment is a very long one. And we need a lot of both moral and kind of financial support for organizations and people who are doing work all the way along that path. And so we can build brick and mortar. That's great, but we have to ensure that folks can get from there to here. And there's a lot of steps in the in-between, and places like Unity and Vina Moses and the Drop-In and Corvallis Housing First, COI, I mean, all of our incredible partners, they're steps along that pathway. And if we don't continue to robustly fund through all kinds of mechanisms, those steps, right, those organizational spots, it won't matter how many brick and mortar things that we have, people are going to not be able to access them. Hi, Jen, we lost Mike.
Mike's disappeared. So here I am. And I've been paying such close attention to the chat. I have not been paying attention to what the three of you have been saying at all. So I'm going to turn toward some questions that have come in. And if there were other things on Mike's list, we'll get there if Mike rejoins us. So one question that's in the chat, the first one I'm just going to start with is about Unity Shelters, about the micro shelter program, Shawn. So there's some question about whether or not you have to have a requirement of income to be in a micro shelter. Is there furniture? Do people go into micro shelters without furniture? How do you get into a micro shelter? Those kinds of questions.
Okay. So I'll just kind of knock those down 1, 2, 3. There's no income requirement. In fact, most of the people that come in, if they have income at all, it might be disability income, or they might be working towards income. So oftentimes we see people that they're not really able to hold a job well when they're sleeping in a tent, right? It's pretty tough to manage that. So maybe one of the first things that they work on when they get into a micro shelter is to get employment, so they can get some income and kind of start down that path. In terms of furnishing the micro shelters, the furnishings have evolved a bit from the early days, which were frankly pretty Spartan. It was pretty much a bed and a table and chair. We've learned a lot over the years about what people actually need and the kind of storage things that they need. So most of our micro shelters now are equipped with a dresser and a shelving unit and a rack to hang clothes from and a bed, table, and chairs. So yeah, when they come in, the micro shelters have heat and air conditioning, we've put a lot more outlets in them than we thought we needed originally, and then they're pretty well furnished now. In terms of how you get in, it's really it's an application process that involves a couple of things. One is we've got some basic questionnaire that helps us understand a little bit more about the history of somebody's housing challenges and what kind of physical challenges they might have. We do background checks to understand if there's anything in their criminal background that might not disqualify them for the program, but might drive some choices in terms of where we might place them, and also to help us understand what that might mean in terms of a housing barrier that we're going to have to try and figure out how to overcome. So there's a process to learn more about that person and the needs that they have, and then kind of a set of decision trees that we go through to try and figure out, okay, which location would be the best fit for this person? Do they have a vehicle? Then there's one location that we have that's really only appropriate if they have a vehicle, because it's not easily accessible by bike or bus. Do they have other needs? Do they have a wheelchair or other things that they need?
Can you talk a little bit about, because this question also involves exiting, like what would, and while I'm asking Shawn this part of the question, Mike, are you back? And are you?
Yeah, I am back. My video is not working, but I am back.
Your voice is back. Okay.
Yeah,
Well, I'm asking Shawn the last part of that question about, like, what does it take to get exited? Which I think is not just a question about micro shelters, but shelter in general. There, how would a person get exited? And what if someone really has permanent, lasting barriers? Are there places that people can stay longer term? So Shawn, that's for you. And then Mike, I'm going to keep texting you questions.
So I think for all of our programs, a lot of it is based on behavior. And just like Allison was describing the barrier and the need to be safe for self and others, many of the exits that we make for people from either shelter or transitional housing are because they're not behaving in a way that's safe, particularly for other folks, either in shelter or in the transitional housing program. Or they've significantly violated the rules of a site. So we do have a couple of sites that are clean and sober at the request of the host churches. And so while we're low barrier as a matter of course across our programs, we do have a couple of sites that are clean and sober. And that's both at the request of the churches that host those sites, but also it helps for folks that are practicing sobriety to be living around other people that are practicing sobriety. So it's nice to have that option for us. Exits, the ideal exit is to housing, right? The less than ideal exit is an exit from the Safe Place Micro Shelter program. And again, it's probably going to be multiple violations of the rules of the program, and those are mostly going to be around safety, really. And again, this is something that we've learned over time. I think that there are infractions that people might have had that we thought when we started the program, oh, this has to be an exit. It's not realistic, right? We have to be able to work with people and understand not only whether or not they're willing to follow guidelines, but able to follow some certain kind of guidelines that we have. So we make a lot of accommodation for folks. We try not to exit people, frankly. It should be as rare as possible. And it doesn't necessarily mean, unless it's an act of violence against staff or another person in the program, it doesn't necessarily disqualify them from being in the program again later. And we've had people that have exited and then come back, either because they've exited into housing and that housing didn't work out over time and they needed to come back and have another round, or they just exited to homelessness and then kind of reapplied. Conditions have changed, they came back in.
A quick question here for Allison and for Shawn. So Allison, you take it first. How does Unity Shelter or the Drop-In Center, how do you expand hours in inclement weather? Heat waves, cold snaps, blizzards, steam alerts, whatever.
Yes, thank you, Mike. So we support inclement weather in various ways. So right now, the way that this works in Benton County technically is that Faith, Hope, and Charity, who is another wonderful organization that all of us partner with, they are contracted to do inclement weather sheltering and support for people when things like you just outlined, Mike, happen. And so they're the point person in a contract with Benton County to do that work. Now, of course, the drop-in center, for example, is part of that puzzle. And so we, it sort of depends. It's usually, I wish that there was sometimes a little bit, we could have a crystal ball and we could get out ahead of things a little bit better. But it depends on the incident. So one of the things we did, for example, last year, so we don't extend hours necessarily. We're open every day, Monday through Friday, no matter what. And I have incredible staff who will show up in whatever weather on those days. One thing that we did when we had that really significant ice storm last year was Faith, Hope, and Charity were helping with hotel programming for people to get inside to hotels. People who were not in the hotels were staying overnight in a congregate setting at First Christian Church. They were staffing that. The drop-in center pivoted all of our work to the First Christian, and we tried to fill the 9 to 2 at least, or 9 to closer to 5 gap as we could, so that for that entire week, people were able to essentially live at First Christian until the ice was manageable, and they the county program said, okay, this is over because the temperatures have risen far enough. But we're definitely also subjected to sort of county emergency weather stipulations around temperature highs and temperature lows, weather like air conditions and stuff like that. Shawn, I'll let you. I know you all do some stuff with extended hours depending, so take it away.
Yeah, we definitely have extended hours during those times. We've also, the city offers something called the winter storm warning permit. And if you have a winter storm warning permit on file with the fire department, you get permission to expand your capacity for shelter. The building code requires that you allow a certain amount of square foot per person in a shelter. During a winter storm warning, if it's a NOAA declared winter storm warning, we can reduce the square footage requirement and bring more people in. So that's one of the things that we've done historically. A lot of it is make sure that we've got more material goods on hand, blankets, gloves, hats, things like that to hand out, extend hours, make sure that, we have hot meals at the hygiene center 4 days a week. And so, through a partnership with Stone Soup, and that's definitely critical during either hot or cold weather events. So yeah, we do everything we can and kind of augment and supplement what Allison does at the drop-in center, what Faith Open Charity is able to do. We've also done kind of pop-up emergency shelter at one of the churches that we work with, First Congregational, to be able to provide access for people who might not be able, because of the weather, to get downtown to emergency shelter, the inclement weather shelter.
Mike, can I just add one other thing really quickly? One of the frustrations and challenges that we've had about not being able to do more around weather supports is the building that we're in is completely inadequate for the work that we're doing. We're in about 2,200 square feet. We're in a capital campaign right now to raise money to be able to purchase a new space that is actually functional for the things that we're doing between 9 and 2 every day. And one of my hopes is that, that new space could serve in emergency scenarios as a congregate space where people could come and do like similarly to what Matt Gordon had so generously offered at First Christian during the ice storm, where people could come and be. But the center as it stands now is materially not equipped to do the things we'd like to do to support even more wholeheartedly for weather stuff. So looking for a new place, and maybe that'll open some new collaborative possibilities.
Okay, and we might come back later to talk about getting a little more background on the search for a new location there at the drop-in center. But I got a question here for all three of you. I'm going to start with Ilene. I mean, as you look around Oregon or hear about other programs going on in the nation, are there other approaches going on to deal with these issues in other cities that you would like to see Corvallis and Benton County at least try?
Wow. Okay. One of the things, I mean, one of the things I think we would all like to see is a space, like a physical space where we can be together, right? And without, I don't know that I have to name that, but there are lots of organizations like mine and like theirs who would benefit from being in a space together. I would say that that's something that's some of it is that there's physically sometimes like there's no place for us to go at the moment. But that I would say that's the biggest thing for us. One of the things that we like to see, right? And we're already kind of doing in this community is having a space, where things are free, where all these buy nothing groups and things like that. And just with that reminder that those are super important, but then also the organizations that the piece that's missing from that, like the buy nothing groups and things like that is that person to person piece where people can get navigation services or help or can answer questions or just kind of connect with another person in a different way. And yeah.
Shawn?
Mike, sorry, it's Allison. Will you repeat the question? Because I was responding to a question about the drop center hours in the chat, and I can't do two things at once.
Understood. The question is, are there approaches in other cities, other states?
Okay. Perfect. That's what I thought.
Yeah. But Shawn, go ahead.
I think that a while back, I think it was a public health person in San Diego that said we're not going to get out of this crisis in the way that we, without doing some creative things. And I think that there are creative things going on. I think that just, down the road in Eugene, Opportunity Village started a long time ago. The rest stops were places for kind of low barrier and small, Conestoga huts, which are kind of a smaller version of the micro shelters that we have. We've got in Austin, there's really low cost community that, housing that's basically tiny homes. And Eugene has our Emerald Village too, that's tiny homes. I think tiny home villages can do it. I think that we need to be more realistic about the reality of camping. And I've seen in the chat some questions about things like, legal spaces to park or managed camping, things like that. We have to do a lot of different things to try and get people into safer places. Ideally, we do that in ways that really provide some real safety for people and the access to facilities, toilets and showers and potable water and all the things that all of us need every day, right? I think that there's a lot of innovation going on in different communities. We sometimes are not able to do that due to local codes that and maybe lack of political will. We've tried to advocate for some things at city council in the past that ended up being killed because the risk of liability to the city exceeds the risk to the people who are at risk living unhoused. And kind of referencing back my earlier comment that we sometimes value property more than people. I think that's a weird equation of risk to say, well, we don't want the city to get sued over doing the right thing. So let's not do that right thing. Right. I think we have to ask more of our elected officials in terms of the way that they assess that risk.
Yeah. Allison, what do you think?
I have a million thoughts, but I'll try and just square up a few. I think that we should listen and learn more from especially Indigenous leaders and Indigenous community members. There's a whole movement called Built for Zero, which is a cool phenomenon, which is about identifying a particular subpopulation in the group of folks who are homeless in your community. So let's say veterans, getting to know those people, kind of the way we do at the drop-in center and at other organizations, but one-to-one as people by name, identify their needs, structure supports tailored directly to them. And I think Built for Zero is cool. I wish that it would, that phenomenon would acknowledge a little bit more the way that those are fundamental practices that Indigenous folks have had in place for hundreds of years as ways of being in community with one another. So I think jail reform and like reentry programs for when people have been incarcerated and are coming back into the communities. And there are really cool intervention strategies that are happening all around the nation around that. We worked with a wonderful scholar who was studying something called kind of care hubs around the nation. And there are these other, we were a featured care hub in this kind of national white paper that she did. And the care hubs they can look really different, but some of the things that they have in common are they're really peer-to-peer driven. They're spaces that are built by people with lived experience, whatever that might be, whether that's a community of artists of color or people who are homeless who are, creating spaces to be together. So I think the more kind of very local grassroots community care hubs that we could have, that would be pretty rad. I also think continuing to push for housing first and as much permanent supportive housing in our communities. We have so many people who could thrive in housing, but they need lots of caregiving, lots of love, and lots of check-ins to be able to do that. And so, the activity, which we never try and do, but sometimes happens, of just sort of plunking someone from the street into a place, it doesn't always work out. And so I think any models that are doing really, really savvy permanent supportive housing work, we want to be looking to those. And, hats off to CHF for doing that, but we all have room to continue, to, as Shawn said, think about really, really creative solutions and how we can be doing stuff better. And that includes the drop-in center.
Well,
Here's a question for, go ahead.
Well, I was just going to say about the whole supportive housing thing is that Corvallis Housing First is doing some super important work, but they need all of us. And so we all need to be able to be there. And it's hard to explain in a lot of ways, but we all across that whole continuum or that timeline that Allison's talking about, where people are getting from one point to another point, it takes every single one of our organizations being able to work together and to be able to talk to each other. It really does take a village. And supportive housing also means that you have to support those organizations that are doing it.
Here's a question for all three of you, and Shawn, I'll start with you in this question. Have there been changes in attitudes or behavior of the city, county, downtown, the general population in the last year or so toward this work?
Well, I think that both the city and the county are trying to lean in more. I think on the city's part, it's more about supporting some of the low income or affordable housing developments that have gone on. I think at the county, it's more hands-on with people, both in terms of making sure that things like harm reduction are supported long-term, but more than that, the programs that are coming out of the Benton County Coordinated Homeless Response Office, the Flexible Housing Subsidy Program, and other things that they're doing have really made a difference. I mean, we've seen a lot of folks move from our transitional housing program into some of those new apartment buildings that have been built on 53rd or down on 99 in Southtown. And it's because of the programs that the county has done and the work that they've done to talk with landlords and property managers to help them understand what we're trying to do in terms of give people opportunity for housing. is it the fullest response that I would like to see? Maybe not, right? I mean, I think there's more that both city and county can do. There's more that the nonprofit community can do. It all takes money and time, and so we're all trying to pull, and I think in the same direction. It's just it's a lot of work.
Allison, same question over to you.
I'll answer this one hyper locally. One of the changes that I've seen, and both Corvallis Housing First before us, because the men's shelter was in the building that the drop-in center is in now, and Alita, as the leader of the drop-in center, did so much ground laying, and so I want to offer a ton of credit where that foundational credit is due. But just in the last 5 years that I have been in leadership at the drop-in center, I've been really excited, and my heart has been filled with joy about how much support I feel like our downtown neighborhood is offering us. We have the most incredible neighbors to our sides. They're willing to come talk with us about anything. We've been able to expand our services into a couple of offices across the street that are now an art gallery that doubles as a Benton County dental clinic, that triples as a low barrier counseling place, that quadruples as a legal aid hangout spot once a month. And those things were possible because I approached our neighbors and said, hey, we want to try a thing. Are you willing to try this with us? And just the other day, I was in a conversation with folks who are right across the street from us, sharing that building. And, there are hard days where our guests are having hard days, and folks downtown in the area where we are, their willingness to work with us and the guests that we serve and to be compassionate in doing that has been really, really beautiful to watch. So that's a real positive thing.
Ilene, over to you. Changes in attitudes you've noticed maybe in the last year or two?
I would say there's been a commitment to really that quiet behind the scenes homelessness prevention work that maybe a lot of people don't realize that Vina Moses and other places like us are doing to keep people in the homes that they're already in. Yeah, I would say there's been a real commitment to keep that going.
Yeah, Mike, I'd just say a little bit more, in terms of community attitudes. I mean, I'm really pleased to see so many show up to an event like this. And I think that what we've seen as we've come out of the pandemic in the last couple of years is people have kind of, surfaced again and are asking a lot more questions and trying to find out how to help and understand. I want to find a piece of wood to knock on, but like, I don't have the kind of NIMBY conversations with people that I used to have. 6-7 years ago, almost every day I talked to somebody who was trying to explain to me how the best solution to homelessness was a series of buses headed in any direction but Corvallis. That's not the conversation I have in the community anymore. And I think that maybe it's the pandemic, maybe it's something else, Christmas miracle, I don't know, but I just think there is a different kind of awareness of the vulnerability that we all share, and it comes through.
I want to ask a question about Stop the Sweeps, but before that, I really appreciated Ilene's answer about something that people don't know about Vina Moses. Real quickly here, Shawn and Allison, what are one or two things that people don't know about Unity Shelter or the Daytime Drop-In Center that they should?
Wow. I guess I'd say a couple things. One is that in one location or another, we're open 24/7. The hygiene center is open 7 days a week. We are serving people across our locations in lots of ways every day. The other thing I guess would be kind of like things that you don't necessarily think about. We've grown a care team in the last year and a half that includes multiple traditional health workers and peer support specialists, has connections to a street medicine project that's been very successful in getting both medical and mental health care out into the community to meet people literally where they're at, not just in our shelters or transitional housing, but on the street in camps. I think that we've really tried to our growing edge is how do we care more about more of the issues that people face, health, mental health, behavioral health issues, and how do we deploy more staff to engage with folks and provide them a caring and empathetic response, right? Our care team, our traditional health workers do some amazing things, and they'll accompany people to medical appointments. They'll make sure, just like Allison talked about, getting copays for prescriptions done. We'll get glasses for people. We do all sorts of things to fill in those little gaps that you don't think about that are really critical for somebody. If you need glasses and haven't had them for a long time, it's very hard to fill out any forms, read directions on how to do almost anything. So getting glasses again can be life-changing for some people. People don't really think about that in terms of Unity Shelter, but we've got a growing team that's working on that every day.
Allison, what are one or two things that people need to know about the drop-in center that they may not know now?
A few things that come to mind. We were offered some real kudos lately about the kinds of work that we're doing specifically to support trans people in our community, whether they're houseless or not. And I just felt really good about knowing that the drop-in center is a deeply inclusive space where people who are transgender are getting the kind of supports that they need. We are a place where people who have no one have people, and we're their people, and we will journey with them as far as we need to go. And one example of that is, and this kind of ties to the other thing that we do that was a surprise to me coming into this job, and it shouldn't have been, but we liaise a lot with families and parents. So I have folks who call me and say, hey, have you seen Justin this week? How's he doing? Have him give me a call. And Justin doesn't have a phone. And then I say, hey, Justin, let's call your mom. And we talk to mom. And that person might be 61 or they might be, 19. So it's a place that people can check in on their people, even if they don't have sort of immediate proximity to them. It's also a place of, in that same vein, really lasting friendships. We make deep connections with people. I had the most amazing honor last year. We had a guest at the center pass away, who I had been in close contact with his family just before, and they actually 4 months later flew me to Colorado to speak at his memorial. And I was the only person who had known him in that room in the last 5 years. And so to be able to just share about people's lives and keep those connections alive when they're wanted, it's incredibly powerful.
And that reminds me, maybe we can put this in the chat of the December 21st event. We have the march and the event at City Hall on the longest night of the year to kind of pay tribute to those folks who have died in the last year. December 21st, I think it starts at 5:30, but we'll see. Maybe we can get some information in the chat about that. Question that any of you could answer here. Do any of your organizations work with the Stop the Sweeps organization?
Well, we do, in that they come get things from us to take out to people.
Okay.
Yeah. And we save things for them too when they need stuff. Like we save things for other organizations as well.
Okay. Shawn, Allison?
I think for us right now, it's, we're engaged in a lot of conversation with folks that are involved with that program and Sunrise Corvallis, and trying to understand, work with them to understand their goals and how they align with the work that other organizations are doing in town. We don't have folks that are going out with Stop the Sweeps right now, but we're definitely in conversation with them.
Allison?
We work very closely with them in a couple of ways. One, they're doing a lot of coalition building right now around advocating with elected officials about how to figure out some more humane ways to interact with people who are living outside. And we have deep involvement in that. We also have, like, in the moment of sweeps, often the drop-in center street outreach team is at an encampment. If the timing jives, we don't have enough capacity to sort of chase the sweeps as they happen. But if the timing jives and we're out there, often sweep folks are there too. And we're offering different kinds of support. You know, sometimes sweeps folks will have a truck and they're helping people physically move stuff while we're liaising with the organization that is doing the sweeps, or helping to de-escalate or ground folks who are experiencing, you know, the movement of their encampment, and how to, like, help them through that process. So yeah, I'm really grateful to them and the work that they're doing. And all of the vibrant youth across a lot of those orgs, Sunrise and Sweeps and otherwise, who are, you know, 21 and so engaged in what's happening locally. It's really awesome.
All right, we're kind of at we're 15 minutes left. We're at the lightning round phase of the evening, which is almost tragic, because a couple of questions I have left are questions that deserve a little more time. So Allison, in a moment, I'm going to ask you to give a really quick update on the drop-in centers project to find a new location. And then I'm going to ask all three of you this question: how do you inspire or teach empathy in people who tell you that, you know, people should just pull themselves up by their bootstraps, which actually is a physical impossibility, and succeed in the meritocracy, so to speak? So that question is pending. Allison, give us a quick update on the project you have to find a new location for the drop-in center.
Sure, Mike. So we our lease in our current location is up at the end of March. We are working to find a new home that would be a permanent home, meaning that we would like to own it. Ownership of a place also opens up a lot of different grant funding strands. It's much easier to access certain kinds of state and federal funding, for example, if you own a property. We are coming along in that. I continue to stay really optimistic. We have some incredible community partners who are helping us in that journey and that activity. Also, like I mentioned before, we are ecstatic about the number of community members who have come forward to offer specifically monetary donations toward a capital campaign. Our goal is to raise $1 million. We've got 600,000 of that. And so stay tuned and stay with us. Thank you to the folks on this call who already are a part of that. You know, our goal in getting into a larger space, as Ilene has already pointed out, is like, it's really useful to have a lot of people in a place. And so we're hopeful that maybe Stone Soup could come and be located with us. There's a unique kind of resilience and respite sheltering possibility that we could grow with Unity. So it's a really exciting time for us, and we're going to make it happen.
I'll let you catch your breath and we'll come back to you on the empathy question. Shawn, what do you tell people who wonder why your clients just can't pull themselves up by their bootstraps?
Well, I guess I'd say a couple things. One is no one really does. I think it's an American myth. It's a particularly Western American myth of the self-made individual. I don't think any of us grow and thrive outside of community, outside of the shelter of other people. We have to, as infants, we depend on other people. As growing children, we depend on other people. As adults, we depend on other people all the time. And I think it would be pretty hard to imagine a human existence that doesn't actually require the assistance and support of others in community to be able to thrive and function. The I mean, the other thing I guess I'd say is kind of back to the ACEs study, the adverse childhood experiences. There's been a lot of study about the health outcomes of people that have had adverse childhood experiences. There's also been research into why some people actually have had high ACEs scores and still survive, right? And thrive and kind of overcome. And it's usually because of caring others, right? Children that have a supportive parent or grandparent or aunt or uncle or cousin, teacher, somebody in the community that says, hey, I know all of these things have happened to you and they're horrible, but I still see your worth and value, and I believe in you, and you're safe in my space. That makes an enormous difference to people, right? And it creates opportunities for people to grow and thrive that they might not otherwise have, right? If I look at my own ACEs scores, depending on how I count, 6 to 8, the odds that I would be homeless as an adult, really high, really high. I had caring teachers. I had a very committed parent. I had grandparents and cousins and aunts and uncles. I had a network of people that made my life possible, that I don't think that any of them would look at me and say, good for you, you pulled yourself up by yourself, right? I mean, they may be proud of me, but they don't, that they know the role that they've played in my life. And I think that all of us can look around and see that, see people in our lives that made a difference at critical moments. I don't think you get to escape that.
Ilene, what do you think?
Well, I mean, I would say not everyone is the same, and that's a good thing. And people need to understand that just because they would experience something one way or react in something one way, that someone else isn't going to do that same thing. And I think everyone can really think about a time when someone's been kind to them when maybe they've not been their best self. And so if you really can have someone think about that time for them and then kind of put themselves in someone else's shoes. And the most basic one, treat other people the way that you would like to be treated. That's a good reminder for all of us.
A toss-up question here for any one of you three. Are there conversational spaces in the
Mike, can I say
community?
2 things about the empathy thing real fast?
Yeah.
Unless you were like explicitly do not have Allison answer that question, in which case I will not answer it.
I'm looking for those texts, so I don't see
You're
it.
like, you shouldn't answer this one. I just wanted to say that, I think that there's something even fundamentally flawed in the kind of, it's not a metaphor, and I guess I used to be an English professor, but I've forgotten, of like, you can't pull yourself up by your bootstraps if you don't even have boots. Like, we have people don't even have shoes. What a silly thing to even begin with as a concept. All I wanted to add was that, some of the things we do is I actively invite people to the drop-in center to like be in a space and see what we do and to exercise their empathy muscles and put aside their fear of what probably ends up being a lot of myths that they have internalized, because that's learned bias that we have. I think we can invite people to really listen to others, and I think we can amplify the voices of people who are marginalized, who have lived experience and have so much wisdom as much as possible. And if we do that and we bring those voices to the forefront and into the community and people are actually listening, empathy becomes a logical extension of just understanding what people are going through.
Well, and I swear this will be the last one. We have to practice everything to get better at it, right? So if you practice empathy,
100.
practice connection, practice all of those things, you will be better at it. We all will be.
So this last question kind of ties into the answer you were just giving, Allison. Are there places in the community, conversational spaces that are purposefully created to connect people who are houseless with folks who are housed?
I can start on that one just because that's one of the things. We're a deeply activist space at the center, and one of the things that we have tried to do to bridge that divide is I mentioned that across the street from the drop-in center proper is what we have termed the annex, which sounds kind of sterile. It's not really at all. It's a healing arts gallery, and it's a healing arts centered therapy space. Isabel Robinson, who is our healing arts coordinator, has done an incredible job to create artistic vision and possibility in our community. And every Tuesday from 12 o'clock until 3:30 or 4, that space is completely open to the public. It's like the Corvallis Arts Walk of the Drop-In Center on Tuesday in the middle of the day. And anyone is welcome to come and be there. And our hope, that hasn't really materialized yet, is that people will gravitate toward that space, and our guests are over there hanging out, talking about their lives, making art, being together. And if folks from our community who want to learn and grow and stretch and experience the fullness of what our community is about, I would just love for people to come over there on Tuesdays. It's I will have that in, I'm seeing someone asking about it in the chat. I'll put the info.
Time and place. Yeah.
Yeah.
Shawn, Ilene, any thoughts on that question?
I mean, go ahead, Ilene.
Well, I was just going to say, it is purposeful in a way, right? Vina Moses runs on volunteers, just like everyone else. And, at Vina Moses Center, I think a lot of people have this conception that people walk into the building and then they go get clothes and then they walk out and no conversation happens. And so all of the work that's done inside of our building, especially with volunteers, are people from all different backgrounds. There are people who are unhoused who are volunteers, and make connections with other volunteers, with staff, and with other people who shop inside the center. So I would say, like, if you have time to give to something like that, then please do, because everyone is welcome in our space. And it's a really, really great place to be.
Shawn?
I just said, if you go to our website, you'll see one of the links is about volunteering. I mean, we have volunteers at both the men's shelter and at Room at the Inn, our women's shelter, and those are in the hygiene center that operates during the day at the men's shelter site. Volunteering in those spaces can be incredibly rewarding and an opportunity to interact with people and see them for who they are, not for the stereotypes and kind of mythology that sometimes is built up around folks who are experiencing homelessness. I think before the pandemic, we had at the shelters a lot more volunteers than we have now, and we've part of the change that we've gone through in the last 5 years is a lot more staff support, which is great. We've got a really well-trained staff, and so that's been awesome. But volunteers make a huge impact. And part of what it does is allow more of that community connection and more time for both the staff and the volunteers to interact with people, and in a way that's not just transactional. Let me get you your socks, or let me get you food, or whatever it is. It's more about, how are you today? And, yeah, of course I've got time to sit down and hear your story, right? I mean, those kinds of things make a huge difference for people.
Yeah, it's about working alongside people with a shared purpose, really.
Yeah. And with that, I'm going to bring tonight's discussion to a close. Thanks to Ilene, thanks to Shawn, to Allison for participating.
Thank you, Mike.
One of the things we have learned, I serve on the Unity Shelter Board, is that we probably need to do more of these community discussions. So keep your eye open for more of these. We have recorded this. We thought, unless there was some kind of disaster, we would plan to publish it at a later time so people can go back and look at it. And that would include, I think, the chat, which has a lot of questions answered that didn't come up necessarily into discussion. So thanks to all of you for participating, for taking the time, and keep in touch. And we'll see you down the road.
And Ilene, thanks for everybody that came tonight.
Yes.
Yeah, thank you, audience. Thanks.
Yeah, very much.
Be well. Happy holidays.
Yeah. Good night.
Thank you.
Yeah.
Thanks, Mike. Appreciate you.
Yeah, thank you, Allison.
Of course.